Hello, and thank you so much for tuning into my podcast. My name is Kara, and I'm a holistic health practitioner for both people and pets. After working for years in the conventional medicine field, I realized that while our lifespans may be getting longer, our health spans are rapidly shrinking. And when it comes to our pets, both their length and quality of life are decreasing. When I turned to functional medicine and a more holistic approach to health, I saw dramatic improvements for my pets, myself, and my patients. Join me each week as I merge natural health for people and pets by focusing on the root cause of disease and applying raw, real remedies that you can use to improve overall wellness for every member of your family, including the furry ones. Hey everybody, welcome back. Today I am joined by Krysta Fox, the holistic vet tech. She is a tenured veterinary technician, a career inspired by her own pug's medical issues, Mr. Bruce. With her years of experience working in traditional, holistic, and integrative practices, working alongside some of the most gifted practitioners in the industry, her varied experiences have played a key part in expanding her knowledge of veterinary medicine. She takes on several roles in the animal industry, including the manufacturing, formulation, and marketing of raw pet food products, as well as veterinary-level consulting on animal health and nutrition. With her combined veterinary and pet industry knowledge, she can effectively help almost anyone she comes across in some way regarding their pet's health. Krysta and her husband, Jeff, own and operate Pug and Hound Pet Apothecary, which I hope to visit one day, a truly one-of-a-kind pet health food store with vet techs on staff and a curated selection of the best pet supplements in the world. Krysta and Mr. Bruce, welcome. Thank you so much for joining me today.
Thanks for having us. I appreciate it.
He's so handsome for anybody who is just listening and not watching. And you can watch on YouTube if you want to see Bruce's handsome face. He's just sitting in her lap being the cutest pug that ever existed.
He's pretty cute.
I got to meet him at Super Zoo.
Yep.
And actually, I need to refollow now that I remade all of my social medias.
Oh, yeah. He does have his own Instagram.
Bruce Wayne. Yes. Bruce Wayne the Pug. I'll have to refollow. Oh, gosh. So we're here to talk a little bit about holistic approaches to chronic disease, which is something that I think a lot of people don't really want to talk about as much or think about as much. A lot of times I feel like we go to a holistic practitioner, we're looking for a quick fix, or even if it's not going to happen super quickly, something that's going to wipe out an ailment, get rid of a symptom. That's not always the case. And sometimes we have lifelong management of chronic diseases. And that is something that you have been doing for Bruce for a really long time. So we're going to take a deep dive into that today. And I'll let you start wherever the beginning is.
Okay, well, Bruce is 14 and a quarter. He celebrated his 14th birthday last September, and he's had quite a journey. He started out totally normal, perfectly healthy pug, really no issues. And in 2015, I had a lot of trauma and a lot of stress in my life, and I did not manage it properly. And in hindsight, I really wish I had, because Bruce, being my little buddy, took on most of my stress and quickly physically fell apart due to it. In 2015, at the time, we thought he just slipped a disc. And so he had spinal surgery to fix that disc. And that's where things kind of just began. That surgery was successful, and, he was able to walk and all of that. But 2 years later, he lost the ability to urinate because a cyst had formed where his previous injury was, and that cyst interfered with his ability to use his bladder. So since 2017, I have had to catheterize him twice a day because he cannot urinate. Unlike a lot of dogs with hind limb paralysis, he doesn't leak. He holds in all of his urine, so I have to get it out of him. So that really was useful for me to have already been a vet tech at that point. But because of his first surgery, I started working at a little natural pet food store and really started getting into pet health more and more. I've always been a junkie about dog food. I mean, anybody who knows me most of my life will laugh about me talking about dog food, even when I was like in college and studying something completely unrelated to that. So when I was working at that pet store, that was when he had his first surgery. And I was blessed to have met Dr. Carl DeStefano, and Dr. Carl is a chiropractic neurologist, and I didn't know anything about him until I met him, and he started helping me with Bruce, and then I formed a relationship with him. He's like a father to me now, but he was a big catalyst in me really getting super interested in the animal health field and not just nutrition and supplements like where I was working. So at that point I think that was 2015, I decided to become a vet tech. Worked in a very, very conventional practice, went to vet tech school at Purdue, learned a lot, but realized in terms of holistic health and just managing chronic disease, the conventional veterinary community knows little to nothing about it. And it's not really their fault. It's just not what is taught. They're taught how to diagnose and treat and not really how to prevent ailments. So when I was working at that clinic and Bruce developed this condition called neurogenic bladder where he can't urinate, he was given a year to live at that point, and he was 7 then. And I was pretty disheartened, but they knew I fed raw. They laughed at me about it. They told me I was going to kill my dog because I was feeding raw. And I was like, okay, I'm kind of one of those people that's like, well, I'm going to show you. So through various diet modifications, I learned how to get Bruce's urinary health like in tip-top shape. He's never had a UTI despite being catheterized twice daily for the past 8 years, which is
amazing.
No small feat.
Like unheard of. And for people who are listening that are not in the healthcare field, just know that that's one of the most difficult things that people and pets with neurodegenerative disorders face is when you're putting a catheter into a hole that doesn't belong, you can introduce bacteria into a sterile environment, causes UTI. Then people get colonized and they get resistant bacteria. Sometimes they end up on suppressive antibiotics when nobody thinks about what that does to the gut. So that is an amazing feat.
And that is actually how most dogs with Bruce's condition end up passing away, is from antibiotic-resistant UTIs. And it's very unfortunate because the group that I'm in called Wheelie Pugs, that's for dogs like Bruce, has basically told me I cannot let people know about the benefits of raw diet and supplementation and how to do these things properly because I'm not a vet. So I said, I'll teach people on this platform how to catheterize their dogs properly because I think I have a pretty good technique. And the woman who runs the group was like, nope, you're not a vet, so you can't do it. And I was like, well, okay. So anyways.
That is infuriating.
Yeah, it was. So from there, I got my experience at the conventional practice and I was already pretty holistically minded. And it drove me crazy. So I was like, I got to work somewhere that, can feed my passion for holistic medicine a little bit more. So I ended up starting working for Dr. Carl DeStefano's wife, Dr. Dina Jersold, who is a veterinarian and animal chiropractor. And then also started working at a fully integrative clinic called Autumn Green Animal Hospital in Geneva. So I still have all of those jobs. I still work for Dr. Carl. I still work for Dr. Dina. I still work at Autumn Green because all of these workplaces really help me gain more experience, know what's going on in the veterinary industry. It's always growing, always evolving, unfortunately, usually with drugs, but I need to know what's going on in order to, help my customers. So in 2018, I met my husband, Jeff. And he had a huge passion for the same things as I did, which I thought I would never find a guy who was interested in that other than we know like Billy, he's like the only guy into all that stuff. So we quickly started thinking about putting a business together. And initially, actually, we were going to do like a dog food truck. And then it kind of just evolved. And I was like, I'm obsessed with supplements. So let's be a resource for people, in-house to have all the best supplements and do things the right way, because there's a lot of pet stores out there. And I think where a lot of pet store owners go wrong is just carrying what everyone else carries and not really doing something special. And I wanted to really be a educational resource. I didn't want to make this a money-making operation. Yeah, I have to, put food on the table, but that's not why I have Pug and Hound. Pug and Hound is meant to be a resource where it is sorely lacking in the field of supplementation. People just don't know about supplements. They don't know how to use them properly. And if you need a supplement in a pinch, there's not a lot of places that have them on hand. So because I've used so many different supplements with Bruce, like arguably almost everything in my store I've used for Bruce at one time or another, because he's got so many different ailments.
Tried and true.
Yeah, for sure. I was like, well, I know how to use these things, and I'd really like to show people that, if their dog has coccidia, there's another way to treat it other than, using heavy-duty dewormers that do deplete the gut microbiome, because a lot of people don't realize that these medications, just because they don't say antibiotic, they still act in that way. Most dewormers are classified as antibiotics, used as antibiotics. Sulfa drugs are a great example of that. So I wanted to, be able to offer that alternative and give people empowerment when they go to the vet's office, to be able to go in and not just think there's only one option for, managing a disease. And especially when it comes to more chronic diseases, supplements and diet are absolutely crucial. I mean, Bruce would not be around if he was eating kibble. I can guarantee it. So that's really the long and short of it. He is the reason I am where I am. I wouldn't have met my husband. I wouldn't have met Dr. Carl and Dr. Dina. I wouldn't have my store. I would be nowhere without this dog. And he has been just my little miracle in terms of all that he's overcome. The doctors that work with him are always amazed how much he's overcome. He got thrombocytopenia in 2020, had several very scary bleeding episodes from that. Unfortunately, that was, I'm pretty sure it was related to giving him a heartworm preventative. It happened 2 weeks
I was
after.
going to ask, was it like immune mediated or prednisone or so, there's.
Yeah,
okay.
and that was the other funny thing. When he got diagnosed with that, the first question I was asked was, when was his last vaccine? And I was like, oh, but vaccines are, safe, right? Yeah, they all know that they cause immune mediated diseases. Fortunately, Bruce hasn't, he didn't have a vaccine. He hasn't had a vaccine since 2013. So, it was more than likely due to giving him a heartworm preventative, which I gave him the one that I thought was the safe traditional one, Interceptor. And 2 weeks later, he came down with this disease, which I have also managed mostly holistically. But it speaks to being in the veterinary industry and understanding the importance of integrative medicine, because things like steroids, especially prednisone can be a life-saving drug. And it is very much frowned upon by a lot of people who don't understand how it is used. And with Bruce, that was a real eye-opener, because the first time he had the thrombocytopenia episode, we treated him pretty aggressively with, immune suppressive doses of prednisone, and it was rough, to say the least. Yeah. And by the fourth or fifth time he had one of these episodes, we decided to treat him based on him instead of a book. Meaning we did not actually do a full immunosuppressive dose of prednisone, and he responded just the same. His platelets came back. He did not need that massive powerhouse amount. And I think it's really important to spotlight that when it comes to dogs and drugs and what we think is the standardized dose, that dogs are truly individuals, like Rita Hogan says all the time, and we need to treat them that way. We need to look at them on an individual basis and work with people who understand how to do that. Fortunately, because I work with Dr. Carl and Dr. Dina, they're both masters of applied kinesiology. And muscle testing and applied kinesiology also gets a pretty bad rap, because there's people who don't know how to use that modality very well. But we actually used AK, applied kinesiology, to figure out his prednisone dose, and it worked amazingly. And he did not need very much to stimulate his platelet production and get back on track. And he has been in remission for 3 years now, which is amazing. But it's crazy how many things I learned just from that disease alone, in terms of like herbs that interfere with clotting. People don't think about those types of things, how these things work with the body. So just to say a supplement is good, like turmeric, great example, tons of benefits to turmeric, but is it right for every dog? Not necessarily. So, it goes beyond just understanding, how herbs work, but to also understand their energetics, your dog's energetics, how they'll respond to certain herbs, because there's a lot of herbs that can do the same thing. So to find the right herb for your dog, the right homeopathic, can take a lot of trial and error. And I think that's where a lot of people get discouraged when it comes to dealing with something chronic, is they just want that fix. And sometimes you just have to work with your dog's body to, help them adjust and find their happy medium, because it's just not going to be a one-size-fits-all approach when it comes to any type of holistic medicine, because you really have to look at the whole dog and not just whatever symptom you're managing. And I think it is still tough. Like homeopathy is a great example of that, where people still want to use these high potency remedies because they want this quick effect. And it's like you have to take a step back and look at things differently than we're so used to, like pill for this, herb for this. Like, how about using herbs proactively? Let's start CBD and mushrooms before there's a problem. I wish so badly that CBD was legal when Bruce first had his issues, which it really wasn't. There was only like Canapet, and Canapet's not my favorite. So there's these tools out there that people don't know, or especially when it comes to cannabis or even medicinal mushrooms, people think they're, psychoactive, these terrible substances that are looked at as drugs that have these incredible properties for preventing disease. And that's probably the biggest take-home message for me is I wish I had done more sooner. And that's a huge reason why I have my store and I talk to people as much as I do, because I really want to drive that home, that you don't turn to holistic medicine as your last resort. Holistic medicine should be where you start. And, as a society, that's hard. It's hard for us to grasp because we're very much used to allopathic medicine and the ways of allopathic medicine. So it's a lot of deprogramming for sure. It's taken me a long time to grasp some of these concepts and really understand that it's just not as easy as use A to treat B. Like, you can't look at things like that. Otherwise, you're going to drive yourself crazy trying to manage a chronic illness, like Bruce has many chronic illnesses. But he's as happy as can be, and everyone's stunned that he's 14 and as happy and healthy as he is. I do blood work on him usually every 2 to 3 months, and it's always crazy to me how well he's still doing. So yeah, that's basically his story and my story.
Bruce is inspiring everyone. I think, first of all, I agree with literally everything that you said. And it's so often our own pets are the catalyst that brought us here.
Absolutely.
When I was growing up, I don't know, maybe in my teens, and my grandma Jane. So I was a little bit unconventionally raised. I was raised by my grandparents, married grandparents, and then on the other side, I have just Grandma Jane. And Grandma Jane, she got to be the cool grandma, the grandma that took me out, and the grandma that taught me to cook and things like that. Well, she loved herbs. She loved teas. She loved, things that were unconventional, which now I would say holistic, right? She used lavender for all kinds of things. She had essential oils that she would put a few drops on my pillow if I couldn't sleep at night. She's the one that I used to look at and go, Grandma, you're crazy. Just take an Advil. And now I look back and I wish that I would have listened a little bit better, but I already was convinced that I was going to be doing something in medicine. And I just kind of had that medicine state of mind. And, she was so right to use those adjunctive things. And, she was, before she passed away, I mean, she was very healthy. She looked much younger than she was. After she retired, she still was, volunteering, and she volunteered at church and at a school and, always up and about and just going. And she really taught me a lot. And I wish that I would have listened sooner. But being able to take those things and integrate them all along rather than waiting until the end, I think people don't realize that it takes time for your body to get into a condition where you need to treat something, right? It took time for you to get sick, and it's going to take probably even more time for you to return to being well. And natural modalities don't work like flipping a switch. Prednisone is amazing. I've seen people come in with severe asthma attacks. They give them some IV and like an IV form of prednisone, and within minutes they're breathing again. People with autoimmune diseases, people with organ transplants.
Yeah.
When you get an organ, unfortunately, you have to trick your immune system into thinking that organ doesn't belong to you. Prednisone is a part of that therapy, right? So there's a time, there's a place.
Absolutely.
The problem is we've kind of gotten to the point where we hand it out like candy and then never take it back. And then you're on it forever. And it just causes a whole host of problems. So temporarily you need it for an emergency. Amazing. Might save your life. But then you have to look and say, what can be done to peel this off or get to the minimum effective dose, or, what is the more natural modality for this? And I'm glad that, the people that you've worked with have been able to really kind of help bolster that. And now it's probably second thought for you, right? You probably see these people who come in and they're like, my dog is on this list of 20 medications. And you go, no.
Yeah. I think one of those, like you said, that it's overused is metronidazole. That one is heartbreaking, to say the least. I have a dear friend. She's one of the technicians for Dr. Dina, and she adopted a cat which was put on metronidazole dozens of times by the time she got it. So much so that his pancreas now was in a state where he developed diabetes that was completely unmanageable. Like, she could, up until the day he passed, she could not get his insulin regulated because something metabolically had gone so wrong over the course of, being put on metronidazole left and right, that this cat had permanent metabolic damage. And things like that happen all too often, where drugs like metronidazole are so detrimental and should not be used the way they're used. I mean, I remember when I first started at the conventional clinic I worked at, I was like, what is this drug you give everybody for diarrhea? Like, I didn't realize diarrhea needed to be medicated like this. Like, are we asking questions like how long this diarrhea has gone on? What did the dog eat? Which, by the way, at that practice, they never asked a client what they fed their dog. They did not find that to be an important question whatsoever, which blew my mind that the thing that they are consuming day in and day out, you don't think needs to be noted, especially with the prevalence of recalls. Like, you're not going to try and figure that out. That was crazy in and of itself. But I mean, the crazy thing for me is I came from that life. I was way over medicated my entire life because I had Lyme disease and mold toxicity. And those two diseases, those two issues come with a list of random symptoms that you can medicate 1,000 different ways. And I was that guinea pig. I mean, I was on uppers, downers, antipsychotics, things that I didn't need because I was just in so much physical pain. And it took me a long time to get to where I am now, where I don't take any prescription drugs or anything like that. But I thought, let's say 15 years ago, that I was never going to be without, a sleep drug, some type of antidepressant, that I had to live that way. I had no idea about gut health, how it influenced your neurotransmitters. I didn't know anything about that until Bruce. It wasn't until I got Bruce and had all these revelations and learned all these things from these wonderful practitioners that opened my eyes. And I went like, wait a second, I don't think I need to be on all these things. And sure enough, I don't. I survived just fine without being on a million different drugs. But I think about all these people and all these pets, how we don't connect the dots when it comes to pharmaceutical remedies, pharmaceutical drugs, and how much they impact our gut and how much our gut impacts us as a whole.
So much.
Our brains, everything is influenced by the gut. And I drive that home every day in and day out at the store, where I'm like, look, your inflammatory response, your immune response, that's all in your gut. Like, if you think Prozac is working on your dog's brain, you have it backwards. It goes through the GI tract. It influences neurotransmitters in the gut, and then it changes how the brain behaves. And that's, mind-blowing to a lot of people. It was mind-blowing to me when I learned of the gut-brain connection. And how important it is for our pets can't be understated, because they don't live as long as we'd like them to. And we're feeding them highly processed food, and we're just not connecting the dots. And it's just crazy to me when, just yesterday, someone was like, oh, my vet said I need to do more grains for heart health. And I was like,
and you threw up in your mouth a little bit. Yeah.
No, I start here. Like,
oh my God.
It's not connecting these dots.
Have you heard of or followed Dr. Mark Hyman at all? He's a functional medicine doctor. So I like that you mentioned Prozac, because one of the things that he likes to say on his podcast is depression is not Prozac deficiency, and diabetes is not an Ozempic deficiency, right? It's coming from the gut. And another thing that he has coined, I think, is that there's a pill for every ill. Well, I would counter that and say that there's 10 pills for every ill, and none of them are actually getting to the root cause of the problem. It's just slapping a blindfold over the symptoms. And that doesn't, mean that the pit that you're about to step into isn't there. You simply can't see it. And I find that to be so frustrating. Antibiotics are linked to depression. Antacids and PPIs are linked to depression. Why do you think that is, people? It's because it's affecting your gut microbiome. And once you wipe out your good gut bacteria that are pooping out serotonin for you to use, you can't be happy anymore. So it's everything is tied together. But for so long, we've looked at everything like they're just separate systems. And you go to 10 different specialists, none of them talk to each other. You end up on 10 different medicines.
That was me. That was absolutely me. And I can't imagine if I'd even be around, honestly, like if I hadn't woken up, because I was so miserable. That's the crazy thing is I really don't know many people who are on any type of mental health drug that can say like, this made me happier. It might have, for let's just say bipolar and schizophrenia, that's kind of a different thing. That's, those drugs can save people's lives. But in my case, I had depression that was related to chronic pain. So I was put on Cymbalta because Cymbalta helps with like neuropathic pain. Did that help my depression? Absolutely not. I was even more miserable when I was on that drug. But you know what else I was doing? I was drinking beer. I was eating gluten. I was eating heavily processed foods, microwave dinners, you name it. Did any doctor ever talk to me about my diet? No, absolutely not.
Not once.
And that's the craziest part is like, this is the foundation of our and our pets' day. Our whole health revolves around what we're consuming day in and day out. And I think that is the hugest part of why Bruce is where he is. If I could cut out, I have cut out all of his supplements for like various reasons, but he still does well because he's on a wonderful diet. And that was the same with me. Once I finally made the turn and went, I need to really overhaul my diet here. Like I didn't eat gluten and I didn't eat fast food and I thought that was good enough. But I had to really make some serious shifts in my diet to see shifts in my health. And I think when it comes to chronic illness, there is nothing more important than the food you're eating every day. And with Bruce, it was really cool because he doesn't have a sensitive stomach. Pugs, are garbage disposals. So I could experiment with him a lot about how food affected him. And that's why I love Chinese energetics so much, is because you can see it. When you have a dog like Bruce that runs very hot and you go feeding them lamb or venison and you actually see how much warmer, like actually physically warmer they become, how much more they're panting, how much more they're agitated, and you see the effect that food has, then you can truly appreciate the I guess it's the phrase that food is medicine. You really see how it affects every part of the body, just food, just meat, or just whatever you're consuming. And then to take supplements and stack that on in terms of looking at them energetically and how they affect you or your dog, it becomes like this magical potion that you can make with whole food ingredients to help heal your dog. And with Bruce, it's been nothing short of miraculous how much herbs and homeopathy have helped him. There was a point when I was catheterizing him early on, I could not stop him from having blood in his urine. And it was a pretty severe amount of blood in his urine. It was getting quite concerning. And if you know anything about that, you know that bacteria loves blood. So it was a matter of time before he developed something serious. So I tried everything I could think of to get this bleeding to stop. I was flushing him. I was doing all this stuff. And then I finally asked Julianne Lee from Adored Beast for help. And 2 homeopathics within 2 doses stopped the bleeding completely. He's never really had this issue since then. And it was homeopathy that fixed him. It wasn't any heavy-duty drug, no anti-inflammatory. It was nothing crazy. It was just simple homeopathy. And homeopathy, it drives me crazy thinking about like how crazy popular and routine homeopathic medicine used to be until the Rockefellers came around and ruined that. And how much it's changed my life and his life. Even just recently, I put him on another Adored Beast product called Rebalancer, and that's meant for like giving after vaccines. But there was a remedy in there that I wanted to try for him because he has like papilloma. It's called Thuya. Thuya is very, very commonly used for papilloma, but it's also a vaccine detoxer. And not only did it help with the papilloma, but it like reversed his respiratory issues. Bruce has like chronic mucousy phlegm, and he was kind of croupy breathing. And this was another chronic thing that I could not get under control. Sure enough, I give him a few doses of Rebalancer and it's gone. I'm like, I wish people could know how amazing these remedies are, but it takes effort to understand homeopathy. Homeopathy is truly individualized medicine. That's what makes it so special, is because it can really get things in the bud, but you have to answer very specific questions about when symptoms are happening. And the way medical professionals are trained now, they don't have enough time and they don't have the training to understand to ask those questions. When it comes to, traditional petrochemical pharmaceuticals, they're not even just big guns. They are bombs to the body. The body does not know what to do with such suppressive medicine. And that's what it is. And that's honestly a huge reason why Bruce ended up having the things he did, is because Julianne kind of taught me it's like a balloon. You can push that balloon down, but something's going to come out on the other end. So if you continue with suppressive medicine throughout your or your dog's life, you are going to encounter some type of crisis eventually. And I think with Bruce, that was his thrombocytopenia for sure. And I didn't understand a thing about any of that. I just thought, I'll just, throw this at him, throw that at him, prevent this, from a conventional standpoint. And then realize like you can only do that to the body so much, where how energy works within the body is just not that simple. You can't just shut things off or turn the volume down on something without it coming out somewhere else on the other side. So, it's a crazy amount of lessons I've learned. I could probably write a book about it.
But probably write 10.
Yeah, for sure. He's been a lot, but he's everything. I mean, he speaks to how much a truly, I'd say, mostly holistic, slightly integrative approach can be with our pets. How important that is to really take everything into account, look at all the tools in the toolbox instead of just, no, my vet said this. Every vet, every doctor, every person has a certain lens they see life through, based on their previous experiences, their traumas, their education. They're all going to have a specific way they look at things. So to only rely on one person as your point of reference for medical care, I think can be a little bit dangerous, honestly. I mean, there's great vets out there that know a lot about everything, but they all talk to one another. They all learn from one another, especially in the holistic veterinary community. There's very much a community there.
Yeah, they collaborate. It's a team. It's always a team effort. Narrow your scope to just one thing it's closed-minded.
Yeah, absolutely. And I think, and it can go both ways. When Bruce was sick with the thrombocytopenia, I did have too many cooks in the kitchen. I was talking to Dr. Suter, Dr. Roman, Dr. Dina, Dr. Grant. I had all these people, Julianne, Rita, I had all these people, great people, but they all had their ideas about how I should treat Bruce. And if you get yourself into that kind of rut like I was in, what I did is I took a step back and I went, okay, at some point I'm going to have to trust my own intuition, because I think pet owners, when it comes to their dogs being sick, they lose sight of the fact that they know their pet best. And that's really the truth. You know your pet best. You see them day in and day out. You know what works for them. You might not trust yourself. Like, I'm very anxious, so oftentimes I don't trust my intuition. But when it came to this, when I was grasping and like nothing is working, I'm doing too many things, I had to take a step back and go like, okay, what makes sense to me for Bruce? What really makes sense to me here? What does he respond best to? And when that happened, that's when kind of the doors opened and he started to heal. Because you can't just throw everything, because there's all these modalities out there, but there's a reason there's all these modalities, is because one thing might not work for your dog. and another thing might. So you have to do a little bit of trial and error and use your own judgment when it comes to that stuff, because there are things out there that, are very widely loved and, this works great. Let's just say ozone, for example, or fecal transplants. That would be my great example for Bruce. I did a fecal transplant on Bruce when he had his thrombocytopenia, and it gave him another relapse because I didn't think about the fact that he had leaky gut. And when you have a dog with leaky gut and you put a foreign dog's DNA into their gut, they're going to have an immune response going, there's another dog's DNA in my gut and I don't know what this is. Similar to, like you said, with an organ transplant. When there's foreign DNA in your system, your body has an innate response to go, I need to attack this. So that was a huge revelation. I thought fecal transplants were ubiquitously, great for every single dog. This should be great. This should help his immune system. This should help everything. And it did quite the opposite. So I think there's a lot to understand when it comes to the gut, and we just kind of throw everything at it. I mean, I see people do it even at the store. They're like, well, I heard this is good and this is good and this is good. Like, let's take one step at a time, give it for a week before you go making a judgment call or throwing 5 things at your dog and then they have a reaction and we don't know what caused it. So
yes, I'm so glad that you said that, because so many people do that.
Yeah, and holistic stuff, yes, it's way more gentle than pharmaceutical remedies, but plant medicine can still be quite powerful. Like when you talk about, gemotherapy or essential oils, those things are very powerful. They can have some profound effects. I mean, I've even seen, I put him on a Chinese herb for platelet production. Within 2 days, his platelets doubled. That was just from a Chinese herb. So people, I think, get this idea that, holistic medicine is like without any effect, when it can be quite powerful if you use it the right way. So you do need to have somebody help guide you through that, which I hope that all the mistakes I've made are helpful for other people when I go like, hey, let's pump the brakes here and let's just try this one thing and see how that goes before we just, oh my God, I heard this was great. I heard this was great. Yeah, there's a lot of great stuff out there, but let's see what actually works for your dog. And when it comes to chronic illness, I think there's a lot to be said for how a chronic illness will impact the rest of your dog for the rest of their life. Like Bruce, he has a spinal cord disease. I didn't know that the spine and the gut feed off each other. I would have never thought about like, oh, I should be focusing on his gut health because he has a spinal cord disease. Didn't know the two were related. But now, of course, I do, because you think about how all those things are connected. There's no organ system that doesn't communicate with another organ system. It's not like they're these individual things. So keeping that in mind, when you're dealing with a dog with chronic illness, like, okay, they have this, but what is the long-term consequence of this disease? What's probably going to happen down the road? And let's start thinking about that and being proactive about that. Bruce is constantly on some sort of gut support for that reason. I have to be constantly managing that because his spinal cord is messed up. So it's all this interconnectedness that I think, I mean, obviously it can get pretty complicated when you're dealing with, especially a nervous system related degenerative disease. I gotta say it's one of the toughest things because there's just so many facets to how all these things work. I mean, Bruce gets adjusted on a regular basis by Dr. Carl, and every single adjustment I learned something that I didn't know before about, the nervous system, the brain, the spinal cord, how this is all interconnected, and it's fascinating. But
That's awesome.
Yeah, it's so crucial that you got to have someone that's wants to teach you. I think a lot of people just want to, okay, well, my vet said this, so I'm going to do this, and don't really understand what they're doing or why they're doing it. And I think that's where things can go wrong, no matter what form of medicine you're dealing with, is that you're not looking at the bigger picture. You're not like trying to understand these things. And I know people are busy and we have busy lives, and that's why I'm such a nerd, that I do what I do so that I can kind of save people some of that time where they're like, okay, I'll go research that. I'm like, have fun. It took me like 4 years to understand this. So
Took me 4 years and 400 hours. Yeah, but it's
like,
it's not even just the like my vet said this and their word is law. I think the other half of the problem is my vet didn't say this and I don't know. And the lack of seeing the body as a whole and how it connects to each organ system and they're all connected. And it makes me think back to my golden retriever, who I shut the door today because otherwise he would be over here barging over and like smacking my elbow. But when he was young, he also got many rounds of metronidazole. And as a person who has spent my entire career in human conventional medicine, I thought nothing of it because of course we give people metronidazole for diarrhea, right? And so, when he was just less than a year old, he was having these huge, explosive, I mean, I have like pictures of him in his crate just drenched in diarrhea when I came home from work. And like, it's really not fun being a single homeowner that weighs 120 pounds soaking wet, picking up your 80-pound dog with his diarrhea wagging tail, bringing him to the bathroom. Many times I did that after a 12-hour shift. And what was the answer to that? Metronidazole. Okay, it would go away for a few weeks. Bam, it would come back. Never one time was there a discussion about his diet. And not long after that, when he started developing hot spots, never was that connected. And then when he got recurrent ear infections, never was that connected. Do you know what the answers were that I got? Well, golden retrievers have floppy ears. They're prone to ear infections.
I love that.
Oh, well, he likes to go swimming. His undercoat isn't drying. That's why he's getting hot spots. So you know what my vet told me to do? Shave him. So I shaved my double-coated breed, and his hair never grew back right. Now he looks like he's been electrocuted, but he's still handsome. I love him, But all of the things that I did for so many years, and it turns out the entire root cause of the problem was he had leaky gut from eating shitty kibble, and he had food sensitivities. And if one single veterinary professional would have said, oh, maybe you shouldn't feed your dog Purina Pro Plan chicken and rice, perhaps he would not have had 3-4 years of recurrent antibiotics and then eventually being put on Cytopoint because he started licking the skin, his foot pads raw, right? So for years, I killed his immune system and then I suppressed his immune system. And, then I threw everything and the kitchen sink at the poor guy trying to fix what I broke. And, finally I found the answer, and that's a full spectrum hemp extract. And now we've gotten down to the minimal effective dose, and it's amazing. It's amazing. And I desperately wish that I had been doing that for years, but I didn't.
Same.
It took a long time, and it took the damage to be extensive for me to go, something is wrong. And he had all those problems. My older dog had chronic pancreatitis. And then I met my husband, and his dog had chronic diarrhea and anxiety. And I had a cat that would puke 3 times a week. And you know what I mean? It's like all of a sudden you take off the blinders, you look back and you go, wow, look at all this destruction around me. All of my animals are sick, even though I'm providing them with the top quality kibble, and they got all of their yearly jabs, and they're on monthly heartworm prevention, and they're, this, that, and the other. And then you realize that all the conventional things were just stirring the pot.
Literally the same thing happened to me. So before even Bruce led me on this journey, I had a black pug named Bluto. He was technically my parents' pug, but he lived with me in college, and he was my buddy. And so I'll try to make this short, but Bluto got diarrhea. He was misdiagnosed. Within 4 or 5 months, he started to lose significant amounts of weight. He was put on ID and metronidazole. And I took him to the emergency vet, because he drank a bunch of water and vomited it in front of me. And I was like, okay, something's really wrong here. This dog is wasting away. What's going on? He was diagnosed with leukemia and lymphoma that day. I put him through the conventional...
I knew you were going to say that.
Yeah. I put him through the conventional rounds of chemotherapy, and he was dead within 5 days, and it cost about $6,000. And after Bluto died, it took me a long time to get Bruce, because I was just distraught. My family was distraught, but I started to put together some pieces, and I went, okay, why would a barely 9-year-old pug, which all of our pugs in my family had lived well into their teens, why would this dog pass away so early, and why would he get such an aggressive form of 2 types of cancer? And I looked back, 12 out of 12 dogs in my family passed away within 3 months of their last vet visit, where they were given multiple vaccines and declared perfectly healthy. They died between epilepsy, multiple organ failure, or some kind of like heart attack where they just passed. And we fed crappy kibble. We fed Eukanuba for the most part. Did all the regular vaccinations, did all the flea and tick meds. And by the way, I also would research the strongest flea and tick medications, and that's what we gave our dogs.
Because you want the best one,
Yeah,
obviously.
I thought, you know, the highest active ingredients would be the best, not thinking about neurotoxicity or any of that. We used carpet powder, lawn fertilizer, weed killers. I mean, you name it. We had done everything wrong. Candles in the house, air fresheners,
Glade scented puffers.
And it was like 12 out of 12 dogs died that way within 3 months of being vaccinated, with multiple vaccines, of course, because back then it wasn't even a thing to just, you know, jab in each shoulder and see you later. And I couldn't believe it when I came to that realization. I was like, oh my God, we have been doing things so wrong, and I didn't realize it until poor little Bluto passed away. And when I got Bruce, I knew a little bit better. I still was feeding him kibble when I got him because I didn't know better. I thought like, okay, well, the breeder said, which is another favorite quote of mine, the breeder said that I should feed Purina 1 and do this new vet supplement, so he's going to be all good. And it wasn't until I started working for a raw dog bone manufacturer, my boss went, why are you feeding him that crap? And I was like, what do you mean? He's like, just feed him raw food. He's like, that's what dogs are supposed to eat. That's all it took was someone to say that's what dogs are supposed to eat. And I went, oh yeah, why would dogs be eating kibble? Dogs just, you know, would eat meat. And my husband's favorite phrase is, what animal cooks their food? Yeah. That's right. No animal except for humans cooks their food. Eating ultra-processed cooked food is not how their biology is meant to process food. So from there, then I was like, oh, okay, I'm going to feed raw food. And then once you get on the raw food bandwagon, I remember I followed Kimberly Gauthier back in the day. I was like, you are so smart. How do you know all this stuff? And she told me a bunch of books to read. And that really was a catapult for me. But once you get into the raw pet food industry, it kind of becomes an easy second step to start learning about supplements and, you know, flea and tick medications and how these things all impact the gut. Because then you start thinking about gut health. Like, oh, God, my dog's looking a lot better. Their coat's so shiny. Their teeth aren't all icky. Like, all these things just start falling into place once you start connecting the dots. But unfortunately, I think it's human nature, and just most people learn the hard way. And I definitely did learn the hard way. And it sucks because as much as I help people on a daily basis with these problems, like you said, it's hard to undo a lot of the damage. And I do not believe in shaming people and being like, oh, well, it's because you did the lawn chemicals and you've been feeding this and you've been doing this. Like, I'm not going to make people feel bad about that because I did that once. I've been there. I've done the wrong things. I've trusted medical professionals in general blindly because they, you know, have a doctor before their name. And that's shaming people for it really doesn't do anything. It's, you have to hone in that, like, okay, where do we go from here? And when you get your next puppy, we're not going to do these things, right? Like,
what are you ready for? Meet them where they're at. Take the step they're most comfortable with. Yeah, because if you shame them or make them feel bad, you have the opposite effect. They just say F you and they're gone. And
anybody will. I mean, like, nobody's going to be like, oh, let me come to this with an open mind while you shame me for the things I've done in the past. And I love in many ways that I do come from that background. So I can tell people, like, look, I've been there. We've all been there. Every single staff member I have at one point was feeding some type of garbage to their dog or their cat and learn better. That's why we're here, to help people learn better and do better. And that's the beautiful thing too, is when they do get another dog or another cat and they make these decisions from the start and go, okay, you know what? I'm not going to do this time. And we see such better health outcomes over the long run. And it's the best. That's the best part, is when you can see these remedies and these protocols make such a difference. I can tell you how many consults I've had that they're just like, how come nobody told me this? Like, how come I've gone to all these people and no one has told me the things you've told me? It's like, well, I guess I just had the perfect storm of shit circumstances to help me, help me learn all this stuff. And Brucey
I swam through the perfect shitstorm so that I could find you and save you from your own.
Exactly. And these our pets just don't live long enough, and they're just perfect little sources of joy and love, and they deserve the best. They really do. So I can't empathize with people who are like, well, this is it. I can only do this because they're just a dog. Well, this isn't the store for you. So if your pet isn't the one
PetSmart is right down the street. Here's the address. You can go there.
Yeah, I am of the belief, being I'm not a childless cat lady, but I'm a childless pug lady, that my dog is my life. He's my world, and I will do everything for him. He is my child in my mind. That's it. Why not? Honestly, they're not bratty. They don't talk back to you, and even if they do, it's hilarious when dogs or cats talk back to you. It's YouTube worthy. So why not do the best you can in this concentrated amount of time you have with them? All they give us is love and joy and forgiveness and just most unconditional love you can ever imagine. So why wouldn't you try to do the absolute best you can for them? You're only going to see that they're going to live longer and be with you longer. So I'm a little bit obsessed, to say the least, about this, because dogs are here to teach us something, whether it's how to forgive, how to love, how to understand illness. They're here to teach us something. Every single customer I have will say that, their dog has taught them something, and that's what they're here for. They're special little beings, and they can teach us so much about health. It's incredible because they don't know the inhibitory emotions that we do when it comes to illness, like when we hold on to trauma and past events and how that can influence us physically. Pets don't know a placebo effect. They just know whether something works. So we can see the power of these things way better than we can see with ourselves, because we know the power of the placebo effect is insane. Like when you really look into that, how like people think that they've been poisoned and they will actually show the symptoms of being poisoned when they took a sugar pill. Dogs don't have that. They just show what we do for them. And I think that's why these type of holistic modalities are so tried and true when it comes to our pets, because they can't really mask it or say like, oh yeah, that didn't work, because they don't believe in it or whatever. They will show us what we give them. So I just think that's amazing. And I think we can learn so much from our pets if we just listen.
I agree. I think that in the end, it's not the dog that you want or the cat that you want, right? You're given the one that you need. And when I adopted Copper, he was my first dog, and he started having all these problems at a young age, and then finally got diagnosed with chronic pancreatitis. As much as it breaks my heart that it took me 5 full years to turn to fresh food, which from the minute I put a plate of raw chicken down in front of him, he has never had a pancreatitis flare again. And that is after 5 straight years of having a flare at least every couple of months.
Yeah.
But I hate that it took me a while, but I am so glad that he brought me along on that journey, because it changed my entire life. I am taking a decade of conventional medicine in the nursing world and putting it by the wayside to move into functional medicine for people, because now I know that there's a better way. So not only did this show me that I can help animals in need, it also completely changed my human career path. And that is something that most people don't want to say in their 30s when they're established in their career. But he showed me the way. This is where I'm meant to be. And it took a little while for me to get here, but now I've come full circle. And I'm just so thankful for him every day. And it's not until you take an animal that has been truly suffering from a chronic condition and you bring them back to a state of health, and you look at them and you look at what practically a different animal they are, and you go, oh my God, this entire time you were only surviving but now finally I look at you and you're thriving. And that is my goal for every single animal and every single person that I hope to be able to help in the future. So,
yep, they're the best. I mean, I can't even imagine for you, like, because you went through, I mean, I went through vet tech school, and that was enough for me to like be like, oh God, like now I know why vet techs are so vicious to one another. And like, I can't even begin to tell you what it's like in a Facebook group of conventional veterinary technicians. If you mention anything outside the realm of pharmaceuticals, how ugly people get, it's insane. It's insane. So I'm sure it's similar in the human health community, but God, it's so like cognitive dissonance is quite a thing. It's really crazy when people, if you're not learning, you're not growing. And the medical field really at its core is meant to be that way. The doctors are meant to always want to be learning the newest things and challenging their belief systems. But the culture of medicine in this country especially is quite the opposite of that. It is do what you're told, reiterate what you're trained, and that's it. Everything is protocol based. I mean, Dr. John Robb can talk all day about that, about how Banfield had these protocol based, medicine that just doesn't work. It doesn't work for dogs. It doesn't work for people. You can't approach something as complex as the human or the pet body with a protocol. That's why this whole AI like taking over medicine is terrifying. Like that's like using predictive text in your phone to diagnose something. It's crazy. There's just so much more to us and our pets from, a physical, mental, spiritual realm. You got to take that all into account. I think that's why holistic medicine is so beautiful.
And you're right. And I think the direction that we're going in, and that's why you just want to be careful when you're looking for somebody to work with, is just see what they stand for, see what their experience is, and just connect with them and see, because the direction that medicine is going in now is, I think the best thing I can do is give you an example. So a couple of months ago, I had a fellow say that they were reading some research about like heart disease and heart attacks and strokes in people of certain ages, and how it's getting more prevalent the younger you are. And they said that even though they had a good lipid profile, they were going to proactively put themselves on a statin medication to keep their lipid profile optimal. And I said, well, you know that long-term use of statins is associated with depletion of CoQ10, which you need for heart health, and can actually lead to worsening lipid profiles and increase your risk of heart attack and stroke in the future. And they looked at me like I grew two heads.
Yeah.
And it's like,
the statin lie is a oof.
Oh my God. And it's people, we are just moving further and further from nature as opposed to returning to our roots. So it's why I have kind of just like checked out of like the conventional stuff now. And, I still work in critical care while I'm finishing up my functional degree, but there's always going to be a time and place for emergency medicine. But then once you have done your acute life-saving measures, then it's time to get to the root cause and figure out what's wrong so that you can actually fix it instead of just covering up the symptom and perpetuating the problem. So
absolutely. And whether it's vets or doctors, emergency medicine is a beautiful thing. When you have a heart attack, when you break a limb, that's amazing. And one of my friends, Dr. Lauren Beard, she said it best. She was like, vets should be there for the same reason, to deal with critical illness, not to teach somebody how to deal with an ear infection. That should be something that not only people should know how to prevent in the first place, but to treat at home. We are inundating vets with problems that we can remedy at home if we just trust ourselves and have a little bit more, I guess,
intuition.
Yeah, intuition is something to be like, okay, I can manage this. I don't need to run to the vet for this, that, and the other, when so many of these things are treatable at home, are manageable at home. Like, I can't imagine dealing with an ear infection going to the vet, but I mean, that's because I've learned enough. But I really think that's a huge reason why vets are so fatigued. They're so drained. They're dealing with things they never went to school to deal with in the first place, like, and aren't taught how to deal with in the first place. Allergies is not something vets go through a course load. They go through a course load to understand, like, serious diseases, weird things that you don't see very often. And the chronic stuff really gets left by the wayside. Like you said, it's just chronic disease cannot really be managed effectively from an allopathic standpoint. There's just not enough tools there to understand and deal with that properly and not end up with, like you said, problems on the other side from these medications. So yeah,
Well,
it can
but slowly
one.
but surely, people like you are educating, right? And even if it's one person at a time, or one person who walks into your shop, or one person who finds you on that Facebook group, you know, it makes a difference. It's slow, but it's happening.
Absolutely.
So tell people how they can find you so that you can make a difference if they need help.
So Pug and Hound is located in Geneva, Illinois, which is about 45 minutes west of downtown Chicago. But we ship anything that's not frozen. So on our website, we have our whole store online. I also do personalized nutritional health consults where we go over just about everything: foods, treats, supplements, you name it. We also have a vet on staff now, Dr. Heather Nickel. She's absolutely fantastic. So if people want a more proactive wellness approach with a licensed veterinarian, we have that as well.
Nice.
In terms of supplements, we have, in my opinion, the best of the best. I have a very, like you said, curated selection. Everything in my store is hand selected by myself to make sure there's no grains, glutens, dyes, artificial flavors, salts, food products from China. I make it my goal to make sure that everything in my store is a good choice for your dog. There's no sugars and crap that is in a lot of other products. So I do think Pug and Hound is really one of a kind in terms of what we offer. We have vet techs on staff at all times. So we have people that truly understand medical conditions, how to manage them. My staff is phenomenally well educated when it comes to nutrition. So all of us can help just about anybody who walks in the door. But if you really want like a full 100% undivided attention from me, booking a consult with me is the best way to go. And I'm always happy to help. I'm always here. I just want to help people know that there's other options before they come to a crossroads and don't have an option.
Amazing. Amazing. All right. I'll make sure that I link all of your links in the show notes so that people can do that and click that easily and be able to find you. And Krysta, this was amazing.
Yeah, this was awesome. I never get a chance to really tell Bruce's story and my story. And I usually just, talk about random things, but it's refreshing. And I think it really hones into why I do what I do and why I'm so passionate and crazy about all of this.
Well, something brings us here, and as frustrating it is to have to go through it when you are, the impact that it makes on both, you growing and then the hundreds, if not thousands of people that you'll touch in a lifetime is insurmountable. And we're glad to have you. So thank you so much.
Thank you.
And hopefully I'll see you soon.
All right. Take care.
Bye, Brucey. Bye, Krysta.
Bye.
Thank you for listening. Please remember that you are the driving force that helps keep small businesses and platforms like mine running. So if you liked what you heard, please like, share, and most importantly, rate this podcast. It's the only way we can reach more people and spread the word about natural health. None of the conditions discussed or recommendations given are meant to replace the advice of your health provider. So if you have concerns about yourself or your pets, please confer with a human or animal health practitioner. Have a super fantastic day, and I'll see you next week.